Hey everyone, and welcome. Today we're going to dive into a real-life medical mystery. It all starts with something as common as an earache, but you'll see how it unfolds into a pretty complex diagnosis. It's a fascinating look at how our bodies try to communicate with us, if we just pay attention. So let me ask you this. An earache, maybe a little fluid, a lot of us would probably just, ignore it and hope it goes away. But what if that's your body trying to send you a much bigger signal? We're about to follow a real patient's journey and find out exactly what was going on. All right, so let's get into the case. Our story centers on a 20-year-old woman. And for her, what started out as just a small annoyance has turned into this long-term problem that's really starting to affect her day-to-day life. Let's take a look at what she was dealing with. Now, this is not something that just started last week. We're talking about discharge from her ear for a whole year and her hearing getting worse for 3 months. That's a long time. And the fact that it's recently gotten worse, more discharge, and now pain and pressure, those aren't just symptoms. They're basically red flags telling her that whatever is going on is getting more serious. Okay, so based on all that, the doctors have a prime suspect. It's a condition called chronic suppurative otitis media, or just CSOM for short. Put simply, it means there's a long-term infection in the middle ear, and this is the key part. It usually means there's a hole, a perforation, in the eardrum. So with a likely culprit in mind, the real investigation kicks off. And you might be surprised to learn that the first tool isn't some fancy scanner or machine. Nope, it's just a conversation. The whole diagnosis really starts with the doctor just listening and asking the right questions. And this isn't just a casual chat, it's a very systematic process. Doctors start with what's happening right now, the main reason you came in. Then they work backward to figure out how it all started and evolved. Then they zoom out even more, looking at your entire medical history, even personal habits. Because honestly, in medicine, every single detail could be a clue. Take that ear discharge, for example. What it actually looks like tells you a ton. Our patient's was described as purulent. Now that's just the medical term for pus-like, and that is a huge signal that there's an active, ongoing bacterial infection, which is a classic sign of CSOM. So why is asking about past health problems so important? Well, think about a condition like uncontrolled diabetes. It can be a total game changer. It affects how your body heals and can lead to really serious complications, which would make any potential surgery way more risky. It's a great reminder that doctors aren't just treating an ear, they're treating a whole person. Okay, so the other big complaint was hearing loss. The next question for the doctor is what kind of hearing loss? The easiest way to think about it is like this. Conductive loss is like a roadblock. The sound is there, but something is physically blocking it. Sensory neural loss, on the other hand, is more like a broken microphone. The nerve or the inner ear itself is damaged. And figuring out which one it is, well, that's absolutely crucial for treatment. All right, the patient story has pointed the investigation in a pretty clear direction. Now it's time for the physical exam. This is the moment where all the talk meets the hard evidence. So after checking for any obvious signs on the outside, the doctor takes a look inside the ear canal. And bingo, they find the smoking gun, the one piece of evidence that connects all the dots of the patient's story. And here it is, the heart of the problem, a 4x4 millimeter hole in her eardrum. That's not just a little tear, it's a pretty significant perforation. This is the physical roadblock we were just talking about. It explains everything, the infections, the discharge, and that conductive hearing loss. But hey, a good detective always confirms their findings, right? So to be 100% sure about the type of hearing loss, doctors turn to this surprisingly old school but incredibly effective tool, the tuning fork. Now, this table might look a bit technical, but trust me, it's the final piece of the puzzle. The first test, the Rinne test, comes back negative in her left ear, which is a classic sign of conductive loss. Then the second test, the Weber test, confirms it. The sound actually seems louder in that same bad ear. It's like the sound is bypassing the roadblock and going straight to the nerve. Both tests are pointing to the exact same conclusion. And there we have it, the final diagnosis, all laid out. We've got the long-term infection, CSOM. We know it's active because of that purulent discharge. And we've confirmed it's causing moderate conductive hearing loss, all thanks to that hole in her eardrum. Case closed. So with the mystery solved, the focus completely shifts. It's not about what's wrong anymore. Now it's all about, okay, how do we fix this? It's time to map out the repair plan. But you can't just jump straight into surgery. You got to do your homework first. A culture test will pinpoint the exact bacteria causing the infection so they can pick the perfect antibiotic. Audiometry will give them a super precise measurement of the hearing loss. And microscopy lets them take one last detailed look inside to make sure there are no other surprises waiting for them. Okay, now for the main event, the surgery. There are basically two main options. A myringoplasty is kind of like patching a tire. It just focuses on fixing the hole in the eardrum. But a tympanoplasty is more like rebuilding the whole wheel. It fixes the eardrum and it repairs the tiny little bones in the middle ear if they've also been damaged by the infection. But really, no matter which procedure they choose, the ultimate goal is exactly the same: to rebuild the ear's natural mechanics, get rid of that infection for good, and clear that pathway so sound can travel to the inner ear just like it's supposed to. So we've followed this entire case, from a seemingly simple complaint all the way to a surgical plan. But what's the big picture here? What are the key lessons we can all learn from this one person's journey? So what did we learn? Well, first, and this is a big one, if you have a symptom that just won't go away, get it checked out. Think of it like your body's check engine light. Second, your story matters. The details you give your doctor are a super powerful tool. And finally, this is really a story of hope. A diagnosis of hearing loss doesn't always have to be permanent. A lot of the time, it can be fixed. And that kind of leaves us with one final thought. Our bodies are constantly talking to us through all sorts of symptoms. This case is just a really powerful reminder to listen, really listen to what they have to say. So, what hidden story is your body trying to tell you?